come in.
Hi, Mrs. Schmidt.
Hi, Nurse Lisa.
I'm Lisa. I'm going to be your nurse today doing your exam.
Nice to meet you.
Thank you. Nice to meet you. I'm going to wash my hands here real quick.
I like to see that.
So I know that last week you were in because you noticed some increased urination and some increased thirst, and you have a wound on your leg that you were having trouble getting it to heal.
I know, it just won't go away, and I've tried everything I can think of.
Yeah, so we gave you some recommendations for taking care of that. Have you noticed any improvement at all?
Maybe a little bit, but I would expect by now that it would be gone, and
Okay.
it's still there. It still bothers me.
Yeah, and what about your other symptoms? Any improvement in those?
Oh, it seems like I'm up all the time at night especially, and I can't get a good night's sleep, having to go to the bathroom.
Okay. Well, I think what we're going to do today is I'm going to do an exam on you, and then we'll go over your lab results from last week that you had drawn, and hopefully we can get some answers to those questions, okay?
I really like that.
So first of all, I'm going to look at your medical history. Now, do you know where you are today?
I think so. I'm here at the hospital in an examining room.
Perfect. And do you know what the date is?
Well, let me see now. I think it's Valentine's Day.
Yes, it is.
A special day.
All right. So looking at your past medical history, I see you have some high blood pressure that you've had for a couple years, and that you're on lisinopril. And it looks like your blood pressure has been pretty well under control. Any trouble taking your medicine at all?
Oh, no. I just take it at a regular time, like I take that at night. So.
And any other medications that you take?
Oh, let's see.
I just see a vitamin listed.
I take a multivitamin.
Mm-hmm.
So I take that every day on
Perfect.
my high blood pressure.
Okay. Any herbal supplements or anything like that?
No.
Okay. Very good. And then I see that you had shingles about 15 years ago, and then you had a broken arm about 20 years ago, and then currently you're having some knee pain that you see Dr. Williams for.
Oh, yes.
How's that going?
Well, I really like him as a doctor, and he's been good at treating me. He gave me pain medication, and then we decided to try the injections, and that's been really helpful.
Oh, good.
It comes from a rooster's comb.
It is interesting what they've come up with, isn't it? And it looks like your family history, your dad's still alive, but he has type 2 diabetes, and that your mom died from complications from a stroke about 10 years ago. Is that correct?
Yes.
Okay.
And my maternal grandmother had type 2 diabetes.
Oh, did she? Okay.
She had her leg removed from the knee on down.
Oh, goodness. Well, I really feel like healthcare has improved since then, so
yes.
No worries there. And it looks like you have 2 siblings, and neither of them have any significant health history. Is that correct?
No, just a little bit of arthritis.
Okay.
And that's it.
So your vital signs today that the medical assistant took for me, it says your temperature was 97.9, your heart rate was 84, your respirations were 18, your blood pressure was good today at 124/84, and that you are 5'2" and you weigh approximately 170 pounds. Does that sound about what you're getting on your scale at home?
Yes, finally I got down to that, and I'm so happy.
Oh, good, good. And it doesn't look like you have any allergies. Do you have any pain today at all?
No.
Okay, very good. All right, so I'm going to have you lay down on the bed, and well, actually, let's start with you sitting up. I think that'll be easier. I'm just going to listen to your lung sounds and listen to your heart.
I hope that's not cold.
So first of all, I'm going to have you just breathe like normal for me. I'm going to listen to your heart. breath in. Same on this side. Listen to the back. Deep breath. Again. All right, that all sounds really good. Any chest pain at all or palpitations? No? Okay. Any discomfort when you breathe in at all?
No.
Any trouble breathing at night when you're trying to lay down?
No.
Okay. I'm just going to kind of look over your head. I don't feel any lumps or bumps. Any skin issues at all that you've noticed?
Mm-mm. Not really.
All right, so now look in your eyes. All right, look straight ahead at me. Pupils are equal and reactive to light. I'm going to peek in your ears. Any drainage or anything like that from your eyes or your ears?
No.
I'm going to look in your nose. Any drainage at all that way?
No.
Okay. Go ahead and open your mouth for me. Stick out your tongue and say ah. Very good. Everything looks normal in there. And I feel on your neck a little bit. Sorry, my hands are cold.
It's mighty cold outside, isn't it?
It is. I don't notice any irregularities at all. Everything looks good. No distension in your jugular veins. I'm going to look at your arms. Any pain or discomfort at all? No. Hands look good. Capillary refill is good. No discoloration or clubbing. Okay, go ahead and hold your arms out for me. I'm going to try and push down, and I want you to push against me. Okay, same thing. Equal. Grip my hands. Equal grips as well. Thank you.
Okay.
All right, I'm going to look at your feet while you're standing there. And your skin looks good here. Have you had any foot wounds at all?
No, I haven't. I just have cold feet.
And again, everything looks good. Your capillary refill is good in your toes, so I think your circulation is good. Good reflexes. You can look between your toes and make sure there's no wounds.
I floss between my toes.
All right, you can go ahead and relax those. Reflexes are good there also. All right, go ahead and lay down and make yourself comfortable.
All right.
I'm going to jot some notes down here real quick.
Nice, comfortable mattress.
Now, Patricia, do you wear glasses at all?
Yes, I do.
Okay.
I'm lost without them.
Now, were you ever a smoker at all?
No, no way.
Okay. Any illicit drug use?
Oh, heavens, no.
And do you drink alcohol?
On very rare occasions, like I have a glass on my birthday.
Oh, that's not much. All right. I am going to look at your stomach and listen a little bit. Any GI distress at all? Any stomach issues at home?
All seems to be fine.
Okay. Normal in all 4 quadrants. And just push on your belly at all. Let me know if there's any pain. Any discomfort at all?
No.
Okay. Now, I read in your chart that you've had a hysterectomy.
Oh, yes.
Okay. Any concerns after that at all?
No. It was a bit of a challenge going off the hormones that I was put on, but the attitude has changed dramatically.
Yes, it
through
has.
the years. So it was like going through menopause at a late age.
Do you have hot flashes anymore?
No, thank goodness that's all gone.
Very good. All right. Any vaginal concerns at all?
No.
Okay. And we talked about your urination. How about your bowel pattern? Any trouble going to the bathroom?
No, it seems to be pretty on schedule and pretty regular.
Okay, very good. Right. I noticed that when we checked your blood sugar here in the office last week, it was 204.
Wow.
Which is a little bit high, so that's why we sent you with that lab slip to get those labs drawn, so we could look into that a little bit further. I'm going to just check one more thing on your feet. Okay, push against my hands. Very good. Pull back. All right. Very good. I'm going to cover your toes up again. I know it's chilly in here. Any history at all of mental illness at all? No? Any anxiety or depression?
No, not really.
And then at home, I know that you're married. Is your husband supportive?
Yes, he's very supportive. He worries too much, though, so I just tell him to calm down.
Okay. And have you noticed any increased bruising or any rashes anywhere on your body?
No, not really.
Okay, I didn't notice anything either, except for the wound that's on your shin, but it does look like it's starting to heal.
Oh, good.
All right. Well, you can go ahead and sit up, and we're going to talk a little bit more and go over your labs.
All right.
Okay. Let me help you up. There. Comfortable?
Uh-huh.
Okay.
Oh, yes.
So what we ordered was a A1C, which is a 3-month average of what your blood sugars have been. And that came back high. That came back at 7.1. And we really would like it lower than that. So what that's telling me is that you have type 2 diabetes right now.
Oh, that's a blow.
I know. Nobody likes to hear that. But there's lots of treatment we can offer you and lots of support. And then it looks like your cholesterol was kind of high also, and that was 230, your overall cholesterol.
Oh boy, my doctor won't like that.
Yeah, and they like that below 200, so I think we can work on that as well. And then your triglycerides, which is part of your cholesterol, is 240. So hopefully we can get those numbers down to a reasonable number. And I think with treating those things, we can get rid of this wound issue and also your frequency in urination and your increased thirst. Because diabetes causes all of those things.
Yes, so I can get a good night's sleep again.
Right, so lots of things that'll make you feel better. So what I'm going to recommend is giving you some prescriptions. One of those will be for a blood glucose meter. And I'm going to have you check your blood sugar once a day in the morning when you first wake up before you eat anything.
Does that mean I have to poke myself?
It does, but it's a very small poke. You'll barely feel it.
Oh, good.
Okay. So when I give you that prescription for that, you can take that to the pharmacy and they'll show you how to use that.
All right.
All right. And then I'm also going to give you a prescription for metformin, and that's going to lower your blood sugars, and that'll get that number under control. So we're going to start with that, and you'll be taking that twice a day.
Okay.
Do you have any trouble remembering to take your medications?
No, I have a pill box that works out really well.
Perfect. Any trouble affording your medications?
No.
Okay, good. And then also I'm going to give you a prescription for Lipitor, and that'll help those cholesterol numbers that we talked about. And that's a pill once a day at night. Okay, so that'll be your evening pills.
I've heard that's really good for high cholesterol.
Yes. And then I noticed that you're very active. Can you tell me a little bit about what you like to do for your hobbies and outside of the home?
Yes, I like to go to the wellness center in Chelsea, and I love my water aerobics class because it's in a warm pool, and this most of us are grandmothers, and we have music from our time in high school in our early 20s, and we sing along to the oldies as we exercise. And I have a lot of good friends there, too. They're very supportive.
Oh, good, good.
And I like to go to a group at my church. It's called Material Girls, and we do crafting, and we sell these to the children at a very low price at Christmas time so they can go shopping.
I've heard of that group.
Have
Sounds
you?
like a lot of fun.
When you sit there and do a craft, your mouth just seems to open and you chat away and you just have a great time. There's something about crafting that makes you want to visit.
Do you have any spiritual beliefs at all?
Oh, yes. I go to the Methodist Church in Chelsea, and it's a very warm, inviting group of people. Again, very supportive people.
Okay. Are you still driving?
Yes, I do. I don't care for these slippery, snowy roads, but since I'm retired, I can just stay home if the weather's bad.
Very good. And do you wear your seatbelt?
Oh, of course. That's the first thing I do when I get in the car.
And then another safety reminder I have to ask about is sunscreen. Do you wear your sunscreen on a regular basis?
Well, not on a regular basis. I know I should because my skin's kind of white.
Right, to prevent skin cancer. So
yes.
I do recommend that you find a moisturizer or makeup that has sunscreen in it.
I need to
and
do
then
that.
If you're out in the sun at all, put some on.
Even in the wintertime.
Definitely. So with this diagnosis of type 2 diabetes, there's lots of things we can give you for support. We have a support group right here in the building that meets once a week.
Oh, do you?
Other people just like you that are learning how to care for themselves and maybe disappointed in the diagnosis, but it's a really good group and I think you'll enjoy that and get some benefits from it.
That sounds like it would be worthwhile.
Yes. And then also, I'm going to have you see our diabetes educator who's also in the building. She's a dietitian and she can talk to you about food choices, how to manage your blood sugars, and what to do if you're sick. All of those things that come up with type 2 diabetes that you need to be aware of.
I know there's a lot I need to learn.
And with that, I recommend that your husband go too, because it's good information for him to have as well, especially if you're going to be modifying some of the things that you make for meals at home.
Okay.
And then your wound is looking better, but I still would like you to see the podiatrist because they can teach you about how to care for your feet and what to watch for so that you don't end up with any wounds on your feet or legs that could get infected and cause problems, because with that high blood sugar, that just feeds right into the infections and makes it hard for them to heal. So it's something we need to try and prevent. And so we'll teach you how to care for your feet and your legs.
Okay.
And then I think probably the last thing is, I know that you wear glasses, so you have an eye doctor, but I would really like you to have a dilated eye exam yearly.
Right, because I've been going every other year. Yeah. That's what my insurance pays for.
So I think with the diagnosis of diabetes, it will be covered under your medical instead of your optical.
Oh.
So it should be a covered exam.
Oh, good.
Yes. We want to make sure that your eyes are healthy and doing okay, because sometimes that blood sugar can affect your eyes as well. So all good things, but we can manage them and make sure that you don't have any problems as long as you take care of yourself. So another really good thing that they have found for managing blood sugar is making sure that you get some regular exercise every day. And so even if that's just going for a walk around the block, going to the wellness center and going on the treadmill, whatever you feel comfortable with, as long as you get some activity and try and increase what you're doing now, that'll really help with things.
Well, I know I'm not as good about exercising in the winter. I don't like to go for walks.
I know the wellness center is really nice inside, especially in the winter. So,
oh yes, I guess they have a track there, don't they?
Yes.
And I've heard they even have deer come up to the windows.
I know, the windows are huge. It's beautiful there. So,
okay.
Yep, if we can
I'll
just
try
try to get in the habit of you going every day and getting some activity. And that way, even you might find that you're losing more weight, which I know you've been excited that you've been losing a little bit of weight.
Yes, I would really like that. I've got a lot of clothes I need to get out of the back of my closet.
Now, if you have any questions after you get home, please feel free to call our office and we can answer those, okay? And I would like to see you back in about a month just to kind of see how things are going and bring in the log of your blood sugars for me, okay? And we can kind of see how things are trending.
Well, I think I can manage that.
Okay.
And I feel more hopeful now because it is kind of a blow.
It is, but we can manage this together. Do you have any questions about any of this?
No?
All right. Well, it was very nice seeing you again.
Nice meeting you, Nurse Lisa.
You're welcome, and we'll be in touch, okay?
All right. Thank you very much.
You're welcome.